How the Clinic Made Gender. The Medical History of a Transformative Idea. By Sandra Eder. Published by the University of Chicago Press. Introduction. Charles was born in 1955. He was a sickly infant, a poor eater and prone to vomiting, but by the age of 15 months his health had improved. His doctor described him as a very happy and healthy boy. When he was 2 years old, his parents became increasingly concerned that his penis appeared too large for his age and that he had started growing pubic hair. They first saw a local physician, who tested the child's androgen production, measured his bone age, and did a buccal smear test to determine his sex chromosomes. Charles, it turned out, had a female XX pattern. He was, the physician told his parents, actually a girl. At the time, doctors referred to Charles as a female pseudo-hermaphrodite. He had ovaries, an XX sex chromosome pattern, and male-appearing genitals. As physicians eventually explained to his parents, he had a condition called congenital adrenal hyperplasia, CAH. An inborn hyperplasia of the adrenal glands, CAH, results in a lack of cortisol and an overproduction of androgen. In Charles, it had caused his genitals to virilize in utero and appear male after birth. The diagnosis also explained why Charles had failed to thrive in infancy, since CAH can cause metabolic problems such as salt loss. Today, medicine refers to individuals like Charles as having intersex traits or disorders of sex development, DSD. These terms indicate variations from what we commonly understand as male and female anatomy. Often the sexual anatomy of children with DSD is only slightly different from what many perceive as standard or average male or female bodies, but sometimes their anatomies result in confusion and debates about whether they should be considered male or female. Although Charles's anatomy had always been perceived as male, after diagnosing him as a female pseudo-hermaphrodite, the local physician recommended that he undergo plastic repair on his genitals and be raised as a female. Charles's parents objected to this plan, which came 2 years after they had been raising him as a son. Their doctor referred them to the Johns Hopkins Hospital in Baltimore to get further evaluations, and 3 months later, in the spring of 1958, Charles was admitted there. At Hopkins, Lawson Wilkins, whose pediatric endocrinology clinic was located at the adjacent Harriet Lane Home for Invalid Children, was one of the nation's leading experts on CAH. In 1950, he had introduced cortisone as treatment for CAH, and starting in 1951, his team, consisting of the psychologist John Money and the psychiatrists Joan Hampson and John Hampson, had studied the psychological health of children with CAH.
Sample complete. Ready to continue?